So there's a very clear definition of obesity. People confuse it being overweight, which is not true. Obesity is a measure of your weight in kilograms divided by a height in meters square, and you get a number. If you are above or equal to 30, you're defined as obese. More than 35 is moderate obesity, and higher it goes, it increases the severity of obesity. So there's a very clear definition of obesity. So instead of types, we can say the classification, and that's based on not the different type, but the severity of obesity. And that depends on how high the BMI is. If your BMI is between 30 and 35, it is moderate obesity. Obesity starts from BMI of 30 and above. But if you are above 40, then it's severe obesity. But we sometimes see patients with BMI of 50, 60, so very, very severe obesity. And that's a very important question, because obesity puts you, anyone under risk with affecting all the organs. So what obesity is a accumulation of fat cells, and people think it's just the fat cells under your skin. It's not just under your skin, it's in your organs. So it can accumulate anywhere in your body, in your heart, lungs, kidneys, ovaries. So whichever part has extra fat cells, that means they don't have their own cells, so it won't work, and you will have a disease of that organ. So it affects everything from airway to down to your fertility. Yeah, absolutely, yes. The way I tell my patients is that they have to first understand that obesity is a disease. And just like any other disease, the management starts with diet and lifestyle changes. But if it doesn't work, then we progress to medical therapies. And if medical therapies don't work, then we go towards surgery. And same is true for obesity. If it's a simple obesity, means BMI between 30 and 35, then lifestyle changes can work. But if someone's BMI is at 60 or above 40, then lifestyle changes will not work. So you have to think of medical therapies and surgery. So bariatric surgery is the most beneficial in people who have BMI above 40, where lifestyle changes and medical therapy hasn't been successful, because that's the only way you can lose up to 40 to 50% of your body weight. So people need to understand that if their weight is around 300 kilograms, which I have seen patients with 300 kilograms weight or 200 kilograms weight, their ideal weight is 100 kilograms less. You cannot lose 100 kilograms of weight just with diet and lifestyle. So you need to seriously think about getting a medical help and surgical help. So it all depends on what kind of treatment they have received. With simple lifestyle changes, restricting your calories, weight reduction can be achieved, but it's not sustainable. The way I explain to my patients is that body sees food and calories like money, like a currency. Just like no man ever says, I have plenty of money, I don't want any more. The body doesn't say that I don't need more fat. So whatever we eat, it gets stored in our banks, which is liver, changed into cholesterol. So body will not lose it. And if you have just lost with diet and lifestyle changes, it's very, very hard, almost impossible to maintain it and sustain that significant weight reduction. But if you had medical therapy, depending on what kind of medical therapy you had, there are newer injectable treatments which can create 15 to 20% of body weight reduction, then as long as you continue that, you can keep that weight off. Bariatric surgery is the most successful, where you lose to 40 to 50% of your body weight, and that can be sustained after many years of surgery. There might be some weight gain, but not back to the baseline, not back to square one, like that you see in simple diet and lifestyle changes. As an endocrinologist, my job is identifying it, that it's a disease, it's obesity, telling patients that obesity is a disease, what treatment options are available, and also making sure that there is not a trigger or a secondary cause of obesity. So there's not an endocrine problem that has caused obesity in that person, and we are dealing with a simple obesity like Cushing's disease, hypothyroidism, polycystic ovarian disease. It can impact on patients' weight, and if there is a trigger and a reversible cause for obesity, then as an endocrinologist I can help them reverse that cause, and that might be enough. But if we are dealing with simple obesity which has no trigger, no secondary cause, then my job is to tell them what a kind of option would be better for them. And if they have very high BMI and I feel that bariatric surgery is the only pathway, only option, then I refer them to bariatric surgeons after having all these assessments. But there are patients who still do not want to proceed with bariatric surgery. Then I can offer them a second best treatment, which is medical therapies and newer injectable treatments.